Welcome to this video. This video is about passing mirror valves. It's an educational video for patients and their families. A passing mirror valve is a one-way speaking valve for patients with a trach. A passing mirror valve redirects airflow through the vocal folds, mouth, and nose, enabling voice and improved communication. The passing mirror valve is a no-leak system, which means that the passing mirror valve remains closed unless the patient inhales. The closed system allows the patient to restore positive air pressure, which simulates a more normal respiratory system. Candidates for a passing mirror valve include patients who have had a tracheostomy in the past. They can be ventilator or non-ventilator dependent. Passing mirror valves work for adult, pediatric, or neonatal patients who are awake and responsive. Patients who have needed passing mirror valves in the past include ventilator-dependent patients, neuromuscular disease patients, patients who have quadriplegia, who have brain injury, who have chronic obstructive pulmonary disease, who have tracheomalacia, who have mild tracheal and or laryngeal stenosis, have bilateral vocal cord paralysis without significant airway obstruction, have non-obstructive laryngeal tumors, have sleep apnea, or patients who are emotionally or physically unable to tolerate tracheal plugging. Patients who are not candidates for the passing mirror valve include patients who need cuff inflation, patients who have a foam cuff, patients with thick secretions, patients who have had a total laryngectomy, or patients with a laryngeal mass or stenosis. The primary pro of passing mirror valve placement is that it reestablishes verbal communication. Verbal communication is reestablished by using the no-leak design of the passing mirror valve. Because the more closed respiratory system that it creates, positive air pressure is restored. This promotes a louder, improved voice, improved swallow, stronger cough, and increased oxygenation. Patients also produce a clearer voice with more normal phrasing, better vocal quality, and increased volume because of all the exhaled air is redirected up through the vocal folds. Other pros of the passing mirror valve include improvement in psychosocial measures, improvement in speech and language development in infants, improved swallowing. Again, because of the no-leak design of the passing mirror valves, the patient has a more normal physiology. This design allows for pharyngeal and laryngeal sensation to be restored and also restores subglottic air pressure, which improves swallow and may reduce aspiration. Secretion management also improves. Patients who wear a passing mirror valve have reduced secretions and may be able to expel their secretions more easily. There's also allows for patients to have increase in olfaction or smelling, as well as vent weaning or decannulation of the trach